welcome to our Monday Minute. Today we're going to do a 2024 hospice year in review and look forward, of course, to 2025. In 2024, hospice had a pretty rough year, basically a roller coaster ride of ups and downs, especially in regard to medical review and the investigations regarding fraud, waste, and abuse. We're going to begin today with the value-based insurance design model. The VBID model had been set to extend through 2030, but as a result of the plans that have pulled out of the program and many other reasons, I'm sure, CMS has decided to end the VBID demonstration effective December 31st of 2024, keeping in mind that any patients that are still on service January 1st who had a Medicare Advantage plan participating in 2024 will become traditional Medicare effective January 1st of 2025 as far as their payments for hospice services are concerned. The Special Focus Program was finalized in 2023, and we began 2024 with not knowing for sure when they would begin the Special Focus Program. We are continuing to fight against some of the parts of the calculation of this program because it is concerning for some of the ones that are winding up in this calculation to be reflected as something that really honestly can't be proven. So we continue that fight. However, with the calculation as it currently is, they have calculated and determined the worst 50 scored hospices in the nation. Those 50 have been publicly reported on the Hospice Special Focus Program site of the CMS website, and those hospices will begin a 6-month survey program where they will receive a survey every 6 months up to 18 months, and then a determination will be made as to whether they have passed this review or they will be terminated from the Medicare program. The next topic is the face-to-face encounters being done via telehealth. The telehealth allowance began with the public health emergency and was extended through December 31st of 2024. With the passing of the American Relief Act on December 21st of 2024, there has been an additional extension of the allowance of telehealth being utilized for face-to-face encounters that is now extended through March 31st of 2025. In 2024, the CAHPS Hospice Survey received a revamping as a part of the Hospice Final Rule. This CAHPS Hospice Survey changes were multiple items being deleted, some being changed or revised, and multiple outcome measures being changed as a result of the new content. They have also updated the distribution methodology to include being able to email a version of the survey to participants. You do need to ensure your vendor for the CAHPS survey protocols is using the appropriate survey effective January 1st. PECOS was another topic of conversation in 2024. You are required as a Medicare certified hospice to ensure that any attending physicians named by a patient or certifying physicians of your hospice are enrolled in the PECOS program or have opted out. The BFCC-QIO information received a couple of updates this year. KeyPro, one of the key BFCC-QIO organizations in the nation, has changed their name to Acentra. You will need to ensure that your information communicated to your patients is updated if it has not been already. And the BFCC-QIO information communicated on the Notice of Medicare Non-Coverage. There is a new form. The Notice of Medicare Non-Coverage form was updated effective January 1st of 2025 with an expiration date of November 2027. The expiration date at the bottom of the form will ensure that you have or are using the appropriate form. The hospice final rule, where many or most of the changes were implemented October 1st of 2024 for the fiscal year 2025, included an additional 2.9% added to payment rates and to the CAP calculation. Hospices also need to ensure that the appropriate CBSA code and wage index is reflected in their EMR systems, as there was a big change or revamping of the CBSA classifications this year. Any that included a CBSA change where the wage index would drop greater than 5%, you will be limited to a 5% change with a temporary CBSA code starting with 50. Please check with your EMR systems to ensure the appropriate information is included on your claims. The HOPE tool will be implemented October 1st of 2025. One of the largest changes in home health and hospice documentation in a very long time. The HOPE tool will replace the HIS, and again set to be implemented October 1st of 2025, giving you the next 9 months to provide significant education to your staff. Lastly, but definitely not least important, the medical review situation in hospice has escalated dramatically in 2024, and we do not see any hope of it slowing down in 2025. This includes a significant increase in UPIC audits, SMRC audits, targeted probe and educate audits, in addition to this special focus program that has started. And we also have seen the surge in prepayment reviews that have been implemented in newly Medicare certified hospices, as well as hospices who have received a significant change in ownership. Hospices need to be very, very diligent, more so than ever before, about the eligibility requirements of admitting patients to your hospice and ensuring that your documentation ongoing supports the eligibility of those patients. Healthcare Provider Solutions is here to assist you with any challenge that you find yourself facing in 2025 as we begin this new year. We are ready to assist with any hospice need that you might have, including these new special focus program surveys. We want to wish you all a very, very happy new year and wish you all the best of success as you do progress through implementing all of these new changes. We also want to thank you from the bottom of our hearts for continuing to care for patients and making that your #1 priority. Have a fabulous week and a fabulous new year.